Today we are going to look at the amino acid enzyme disorders and also the associated enzymes. So the associated enzymes as well. So first we move on to asking some questions. First question we want to ask is in case of the phenylketonuria. So in case of the phenylketonuria, what is the enzyme that is defective? Now the second question is in case of the maple syrup urine disease, MSUD, what is the enzyme that is defective? The third question we want to ask is in case of albinism, what is the enzyme that is defective? So in this video, we'll find the answers to all these questions, and in the end, there are also some bonus questions. So first, to start with, we're going to start off with the phenylketonuria. So in this phenylketonuria, the enzyme defective is nothing but the phenylalanine hydroxylase. So this is the enzyme that is defective. Now moving on, we also have the tyrosinosis. That is nothing but the tyrosinemia. That is nothing but the tyrosinemia type 1. And now, what is the enzyme that is defective here? Enzyme defective here is nothing but the mallyl acetate isomerase. So the mallyl acetate isomerase, or it is nothing but the fumarate acetoacetate hydroxylase. Then we look at the MSUD. So MSUD is nothing but the maple syrup urine disease. So under MSUD, there is the branched chain. There is the branched chain. There is the alpha keto acid dehydrogenase. So in short, it is known as the BCKAD. Then we move on to the alkaptonuria. So what about alkaptonuria? So in alkaptonuria, the defective lies in the homogentisate oxidase. So in case of the alkaptonuria, it is homogentisate oxidase. Now we move on to albinism. So in case of albinism, what are the enzymes defective? So in albinism, the enzyme defective is the tyrosinase. And then looking at homocystinuria. Homocystinuria. So in case of homocystinuria, what is the enzyme that is defective? This is specifically type 1. So it's type 1, it is the cystathione. It is the cystathione and synthase. Cystathione synthase. Then we look at the homocystinuria. Type 2. So type 2 is linked with, it has a defective, it is a defect in the methylcobalamin. So methylcobalamin formation. So this is what is defective here. Then we move on to the cystathione urea. So in case of cystathione urea, the defect lies in the cystathionase. Then after this, we also have the tyrosinemia. Tyrosinemia type 2, also known as, or the Richner. The Richner-Hanhart syndrome. So Richner-Hanhart syndrome. So this, the enzyme defective here is nothing but the tyrosin transaminase or the tyrosine amino transferase. Next, we move on to the primary. We move on to the primary hyperoxaluria. So in case of primary hyperoxaluria, the enzyme defective is the alanine glyoxylate aminotransferase. Then we move on to the hypervalinemia. So what is the hypervalinemia? So here the enzyme defect is of the valine transaminase. Then we look at the isovaleric acidemia. So hypovaleric acidemia, it leads to the enzyme defect of the isovaleryl CoA dehydrogenase. Then we look at the histidinemia. So histidinemia, the enzyme defect is of the histidase. Enzyme defect is of the histidase. And lastly, we look at the hyperprolinemia. So hyperprolinemia type 1. So what is the defect here? The enzyme is proline oxidase is the enzyme here. So now we are going to answer our questions which we initially asked. The first question we asked was, in case of the phenylketonuria. First question was phenylketonuria. In case of the phenylketonuria, what is the enzyme defect? Enzyme defect here is nothing but the phenylalanine hydroxylase. The next question is, in case of the MSUD, that is maple syrup urine disease, the enzyme defective here is nothing but the branched chain alpha keto acid dehydrogenase. So in short, it is known as the BCKAD. The last question we asked was, what is in case of albinism? So in case of albinism, the enzyme defect, it is the tyrosinase. It is the tyrosinase. So then we'll move on to some bonus questions. So what are the bonus questions? So here we want to ask, first question is, in case of the tyrosinosis, that is the tyrosinemia type 1. So here, what is the enzyme that is defective? That will be the first question we want to ask. Second question is, in case of alkaptonuria. So here, what is the enzyme that is defective? Lastly, in case of the homocystinuria, this is type 1. So what is the enzyme that is defective here? So you can answer these questions in the comments.